Hello, and welcome to Mental Health Matters podcast. I'm your host, Liz Lang, and I'm here with Dr. Mark Burton. In this podcast, we will talk about all things mental health. Thank you so much for joining us. Hey guys, Liz Lang here with Dr. Mark Burton. And this week, we are going to get into sleep disorders. So this episode stems directly from my personal life. I was recently diagnosed with a sleep disorder. So we're going to talk about some of the common ones and some coping mechanisms. And you're also going to get to hear my story and how I've dealt with it. So one thing to start off with from the beginning is that sleep disorders, they require medical diagnosis and usually a sleep study. So I don't want to get too much into the science of it all because you need a medical doctor in most cases in order for this to be diagnosed and for treatment. But there are ways to cope with sleep disorders.
Right. I think there's an exception to that there are certain psychologists who are certainly trained in it who can give that diagnosis as well. And here's this is a crazy thing. I'd forgotten we were going to talk about this tonight. And so last Friday, though, I did a CEU. So CEUs means continuing education unit, I guess.
Okay.
Anyway, in the state of Utah, you need 48 every 2 years. And so this was on sleep disorders. And the presenter, she is a psychologist, but in the sleep clinic at the University of Utah Hospital. And so she's within a medical setting. So I agree with you. Like if you were just going to someone like me, I wouldn't be able to diagnose a sleep disorder. But someone like her who is specially trained and within that context of a hospital and a sleep clinic, then she's able to do that type of diagnosis. But I want to say at the outset that this is not an area of strength for me. I mean, if there were issues like sleep issues that we just couldn't get a hold of, I would always refer someone out for a sleep study or a sleep clinic, where they have expertise. Because I think it's complex. It's really complex. I think the different diagnoses are complex. And then I also think the way they study them, the way they, decide or do the studies, I think technically it's kind of amazing what they can test nowadays, but it needs someone who's an expert in this type of thing.
Yes, and I mean it's neurobiology is really what it comes down to, which is a vastly different field than psychology. I mean, they're related in that they both interact with the brain, but they're also related in that, well, human beings have a brain.
Right. But there are also, again, there are psychologists, neuropsychologists. And so it's a special area of treatment. And so when I went through my training, you might do 3 months of it. It's one of those things that you do a rotation through. But if you wanted to, I had friends, BYU has a pretty good program. I can't remember the guy's name, but he's probably retired now, but pretty well known for his neuropsychology training program. And a lot of people who wanted to be trained in neuropsych would go there to be trained by him. And so it is a specialty, but you're right. It's about, the brain. And that is certainly part of psychology, but it's more of a specialty area. Like if you're doing neuropsych testing, you really have to be up on it all the time and be doing it. And so I did it back in the days when I was training, but since then, no. And I wouldn't even dip my toe in that at all now. I'd always refer out to someone else.
You're very happy helping people with their emotional problems.
I'm happy what I'm doing, and you can't do everything. And so, but the thing with doing the type of work that I do, I think I've told you this, that in the first session, I'll always ask the client about sleep. Always. And so, in fact, my last client of the day, he's tired all the time. And so I was just going to do like a mini assessment. I mean, my assessment is just to try and get him to start thinking about where could he go, or mainly to move him into that mindset of maybe he should get some help with this because he gets 8 hours of sleep pretty much every night uninterrupted. He goes into REM sleep, but it's very light sleep. He has one of those trackers, but he's always tired.
Yep.
And so I think being tired, as we've
Mm-hmm.
said before, lack of sleep makes everything harder.
Yeah.
And so I think if you're always tired, it's worth pursuing, and probably with a medical doctor would be the first a line
Yep.
of defense, or because I would guess even to get to a sleep clinic that you'd probably need a referral from your internist or your
I did. Yeah.
family doctor.
Yeah.
And so the first place you're going to go is to say to your doctor, I'm tired all the time or something's going on.
Yep. Yeah. Your PCP, your primary
Yeah,
care physician, is the
right.
first place. And that's exactly how my story started. So before I get into my story,
Yeah.
I want to briefly mention some common sleep disorders. The
Mm-hmm.
most common one that people are familiar with, it may not be classified as a disorder, but it's still a common, very common issue, is insomnia,
Right.
or you can't sleep. Many
Right.
people deal with this, and there are plenty of tips and tricks you can do both psychologically and medically to help with that. One caution I would give is overusing melatonin, because melatonin, it's meant to help reset a sleep cycle. It is not meant to treat permanently insomnia.
So I always thought, you take melatonin and it helps you fall asleep. So this is what I learned on Friday is
Mm,
people are using it incorrectly. And I suppose for a lot of us, the use of it might be like if you're traveling across time zones
yep.
and you want to reset. And so this presenter was talking about how if you want to do that, I can't remember, but you're taking it maybe 5 or 6 hours before you want to go. It's a
Mm,
resetting. So
yeah.
it's not actually something that's going to help you fall asleep. And she's saying that if you find someone who says, yeah, it helps you fall asleep, it's most likely a placebo effect, which is
Mm,
pretty strong for most of us. But you're right. It's really meant to reset your circadian clock.
yeah.
Is
Yeah. It's
what,
not.
no.
Yeah, and I would also caution against sleep aids for some people, because those can exacerbate other problems, and I'll also come to that. So
I
sleep,
think the sleep aids can be problematic, especially if you're
yeah,
taking like,
you can,
some of that can be pretty addictive. And then when you come off
yeah,
of it,
it's even worse.
the problem is you get, I think they call it a bounce back effect or something.
Yeah.
It really sets you back. I think the thing I wanted to say about insomnia is that is somewhere where a psychologist can be really helpful.
Yes.
Someone who's actually trained in it, though. I don't know that I mean, the only thing I would help someone with is often insomnia is caused by anxiety and worry, and their
Hmm.
mind just won't shut off, and it's just spinning all the time. And so I think that I feel pretty comfortable trying to help someone through. But there are psychologists who specialize in sleep, and
Yes. Yeah.
so seeking one of those out specifically for, say, insomnia would be helpful because I don't know that.
Hmm.
I mean, aside from sleep aids, I don't know that there's a medication specifically like you might have, say, for narcolepsy or
Right.
something like that. And so I don't know. I would caution our listeners to be really careful about sleep aids. So,
Yes. Yes. Be very,
uh,
very careful with them. So, sleep apnea is a very well known sleep
right,
disorder. This one definitely requires a medical everything. So, you have to have a medical diagnosis, you have to have a medical practitioner for treatment. And so, sleep apnea is you stop breathing in your sleep, which is
right.
not good for you at all.
No. Well, no, and so, it's your brain, there's this automatic response, like, if you stop breathing, it wakes you up, and then you
Yep.
go back to sleep. But the thing that I learned about apnea is I think there's a misconception that it's always about people who are overweight, which isn't
Hmm.
true. I mean,
Yeah.
it can occur in people who are thin as well. I did a sleep study many years ago, and it was awful.
Yeah.
I had to go into this place, they hook you up. And this woman was saying that nowadays that insurance companies prefer to do it at
At
home,
home.
and that
Yep.
there are, several ways for you to do that. And which is great that
Hmm.
now that the technology has progressed, that it's going to be easier to get that diagnosis.
Yeah.
And then additionally, so I tried a CPAP and it was, but again, this is I don't know, it's 20 years ago. And I
Yeah.
think the CPAPs now are very different than what they were, again, because of technology. I think lots of times you could instead of a mask, I
Mm-hmm.
think that you can, I think they have just the nose things, whatever they
Yeah.
call them.
Yeah.
And so where someone like this psychologist who's trained in this can help people through that initial adjustment period, because that
Yes.
adjustment period of getting used to the CPAP can be difficult. And I think what happens is a lot of people try it, they find it hard, and then they quit. Seeking help from someone who's going to help you with that transition through the cognitive behavioral therapy can be very helpful. And they find a lot of success with that.
Yes. And so again, it's that adjustment because you're wearing something on your face and you've never done that in your life, and that's hard.
Yeah.
My dad went through this, and a lot of times what most doctors recommend is you just have to keep trying, and you might find that you're going to take it off in your sleep. Like you'll wake up and it's off and you have no recollection. And again, you just got to keep kind of pushing through it because the effect is worth it. And my dad has felt that in that it made a huge difference for him in just feeling more awake,
Yeah.
right? And
Yeah.
so it's an adjustment, but it's worth it.
Yeah, I think the standard is you have to use it. Like insurance companies will pay for this under certain
Hmm.
conditions. One, nowadays they can track it. They can track your
Yep.
use,
Yep.
and so it has to be for at least 4 hours a night. And I can't remember again, so many nights a week. And if you don't use it, then they'll just take it back and they
Mm,
won't pay for it. But I think you're right. Most of it is, just sticking with it and getting
yep.
used to it. But again, I think there are some techniques that a psychologist can help you through
Hmm.
that adjustment period.
Yeah, absolutely. Okay, so narcolepsy is much, much less common and also less known.
Right.
So now, narcolepsy is what I was actually initially tested for.
Hmm.
But the important thing with narcolepsy is there's two types. So type 1 is with cataplexy. And so
Hmm.
cataplexy means loss of muscle tone. So sometimes people have heard this, the people who will just fall asleep at the drop of a hat. Like they can be standing there talking to you and all of a sudden they fall asleep.
Yeah.
That type 1 narcolepsy, and it is very, very rare. Type 2 narcolepsy, I think, is just a fancy way of saying excessive daytime sleepiness.
They have initials for everything. So
Yes.
EDS
Yeah. Yeah.
is what that was referred to as.
Yeah, narcolepsy without cataplexy. And
Hmm.
so that just means that your body is just tired and wants to sleep. And then there's this other one that's a catch-all, and my official diagnosis is idiopathic hypersomnia. And
Okay.
when people ask, what does that mean? I tell them, I'm tired.
Well, but the idiopathic reference really means we don't know what's going on.
Yep. That's why it's a catch-all.
So you have hypersomnia, and we don't know why.
Yeah.
So we'll give it this fancy name of idiopathic hypersomnia.
Pretty much. It's a fancy way of saying chronic fatigue.
Uh-huh.
Well, and
Yeah.
see, and that's the thing with
Because chronic fatigue is again something different, but
yeah. So the important thing with this hypersomnia, so hypersomnia being the opposite of insomnia,
uh-huh.
instead of not being able to sleep,
You're
you
just
want
sleep.
to sleep all the time.
Yeah.
And so that's where my story really started and it started around the time I started having kids. And so for years and years and years, I just made excuses. Oh, of course I'm tired. I've got young kids. Oh, of course I need more sleep. I've got a baby. Where it really got difficult and when I really decided, okay, something's not right. I have to do something about this was the beginning of this year. My son was 3.5 by this point, and he was a horrendous sleeper for a very long time. For it took him 2 years to start sleeping through the night. And so I went back to school in January. And so and my, getting a degree, I have a lot of reading to do because marriage and family studies is my undergraduate degree. And it's just a lot of reading. And I was getting 7 to 8 hours of sleep at night and still just struggling to get through my reading because my eyes would get so heavy that I felt like I couldn't stay awake. I couldn't focus. I couldn't do anything. My brain just refused to stay awake. My brain was not going to take in any information because it wanted to sleep. And it really felt like I didn't have a choice in the matter. I mean, yeah, I could get up, walk around, and that would help, but I'll sit down again, and 15 minutes later, I'm in the same
Mhm.
problem. And so I finally talked to my doctor about this, and he said, well, the first thing I want to try is blood work. And if that comes back normal, which I suspect it will, then we're going to try reducing your medication. So I've been on the max dose of sertraline, often known as Zoloft, for a very long time. And he said the number one side effect of sertraline max dose is fatigue. So we're
Okay.
going to reduce it in half. So I did that for about 3 weeks and I was still having the same problem. So I went back to my doctor and he's like, okay, we're going to order a sleep study and we're going to test you for narcolepsy. And when he first said narcolepsy, I thought, I don't fall asleep and like, I don't just fall asleep at the drop of a hat, thinking of kind of almost like that classic narcolepsy that you kind of see in movies or in
Right.
comedy, in comedy scenes. And he's like, well, there's two types. So he ordered a sleep study. And the next thing I did was really work on my sleep hygiene. I mean, for about 2 months, I had near perfect sleep hygiene. I was going to bed at or around the same time. I was waking up at the same time. I was not using my phone in bed. I was not reading in bed. I had a bedtime routine. I was really diligent about my sleep hygiene, and I was still having this issue. I was still tired. And I was also
Did
exercising regularly too.
did it make any difference at all?
It
Just
helped. It
a
did.
little bit, but not a
Yeah,
lot.
it helped a little bit, but not a lot. So they ordered the sleep study, and now this is a sleep study that can't be done at home. And the reason being is there was two sleep studies. So there was the overnight sleep study where they do what feels like plugging you into the matrix because they attach.
That's what it felt like.
Yes, because they attach at least, I think, oh, I'm trying to remember. It was at least
A lot.
12 different
Yeah.
electrodes to your scalp.
Yeah.
And
Yeah.
then, and the side of your face, and then they do all sorts of stuff. And then they're like, okay, go to sleep.
Yeah, I said, "Right." Like, I'm gonna go to
Yeah.
sleep. Like, yeah, I
Yeah.
remember. It was awful.
Yeah. So what they do the next day is what's called a sleep latency test. And so
Mhm.
a sleep latency test is a series of 5 naps spread out at least 2 hours apart. And
So
they are,
did you have to stay in this facility all day long?
hmm
Oh, wow.
yeah,
But
yeah,
that was boring a little bit.
yeah, yeah, a little bit or a lot bit, but
Wow.
and so I had to stay in this room and they had it set up as kind of an upscale hotel suite. And, so I had my own private bathroom and they brought me meal, like they brought me breakfast and lunch that was
Mhm.
included, and another big part of this is I would often tell people if napping were a profession, I would be really rich
Uh,
because it's like a superpower. I can sleep anywhere. And people are like, wow, that sounds really nice. And I'm like, until you don't want to sleep, because I also will sleep anywhere. And, it's problematic, say, when you're driving or trying to study for school. And, and that was kind of where I'm like, I have to seek help is I was starting to get so tired driving that I had to call somebody
mhm.
and I had to be talking to stay awake. Anyway, so now the sleep latency test, what they were looking for is how quickly you fell asleep. And they were also looking to see if you hit REM. So if you fell asleep in 8 minutes or less and you hit REM in at least two of your naps, then you probably have narcolepsy. Now, the naps are only 15 minutes long.
Right, and so did you ever hit REM in that time?
No, I
Okay.
never I never hit REM. So, like one of the things that I felt like was a little bit inaccurate for the test is it only tracked that you fell asleep because there were several times where it's like I would start to nod off and then I'd wake up again and then nod off. And so, but it didn't track that I woke up and then nodded off again. So, that was one thing that I felt like maybe wasn't terribly accurate, but
Mhm.
I still didn't hit REM in any of them because they said that, or if you take 8 minutes or more to fall asleep, that's considered pretty normal because they say if you leave anybody alone in a dark, quiet room for 8 minutes or 15 minutes, they're probably going to fall asleep.
Mhm.
8 minutes is kind of the standard. Anything less than 8 minutes, then it's like, okay, there's something going on here. My average time to fall asleep was like 4.5 minutes. So it was very, very quick. For two of the naps, I fell asleep in 2.5 minutes.
Oh, wow.
Yeah. So again, if sleeping, like, it's like a superpower that's also a curse because, you know,
Well, so, when you go to sleep tonight, do
mhm.
you fall asleep very quickly?
Oh yeah.
Yeah.
Yeah. I mean, if and in this nap, I was really trying because I was like, something is wrong. I'm going to prove to them that I am tired. And so, when I went to see my sleep doctor, one thing that he said that felt really good to me is he said, you don't just perceive that you are tired. You are tired. Your
Mhm.
brain just wants to sleep. And so he said there was two abnormalities. The first one was in the overnight sleep test was you had a lot of leg movements, a lot of limb movements that were disturbing your sleep. So you're waking up a lot and your wakefulness was tied to your leg movement. And so he brought up restless leg syndrome. I didn't think
Mhm.
I had restless leg syndrome because usually restless leg syndrome will wake people up
Uh-huh.
at night, and I've never woke like I my legs have never woken me up or my movement has never woken me up. And I've been sharing a bed with Curtis for 12 years now, and I've never woke him up moving my legs.
Well, so
So,
does the doctor say that the leg movement, though, is somehow disruptive to a good night's sleep?
mhm,
Is that it?
yeah,
Even though
because
it doesn't wake you up, it's still disruptive.
yes, it was disrupting my sleep because I wasn't coming fully awake, but I was waking up. And it's normal for people to kind of slightly wake up a little bit at least a couple of times a night and then go right back to sleep. I
Yeah.
mean, I'm pretty sure almost everybody will do that.
Mhm.
It's like they're semi-conscious, but they're able to go right back into sleep. And so he said that that was definitely a problem. And so he wants to check my ferritin levels. Now,
Mhm.
ferritin is different from iron, and the way he explained it is iron is like what you see on the shelves at a grocery store, but the ferritin is the supply, like your stock in the back room. So just because there's supply on the shelf doesn't mean that your overall supply is okay. Doesn't mean that your overall inventory is doing okay. So that's the way he explained it to me. And so ferritin is basically checking the efficiency of the way your body uses the iron. So because my
Have you done
hemo
that yet? Have you done that yet?
I haven't yet, but I've had my iron checked before and my iron levels have always been fine.
Uh-huh.
And so, and that can be a thing. Like, you can have an iron deficiency and your iron levels still be fine because there's iron in your blood, but your body isn't necessarily utilizing it properly. And that can cause a lot of problems. So the other thing that he said, the other abnormality he said was your average time to fall asleep. And
Mm.
so, he's like, this isn't narcolepsy, which is good news, but you still do need to take precautions. So he said, don't drive if you're tired, don't operate heavy machinery if you're tired, because you will fall
You need to
asleep.
get off that backhoe.
Right. I gotta, yeah, I gotta stop with the excavators,
I know.
guys. He said that you do need to take these precautions.
Mhm.
And now, when I first started looking into this, my my concern is that I'm going to be on this, on some sort of medication that I'm going to be dependent on. And I'm like, man, I don't know if I really like that. But I was so fed up with it and so tired of being tired all the time that I didn't care. I just wanted a solution. Well, he came up with a solution that I really love, because one of the things that I've discovered probably in the last 6 months or so, my biggest coping mechanism with the daytime fatigue is exercise.
Mhm.
And so what I've discovered is that because when summer hit and when the hot temperatures hit, I would do a bike ride earlier in the morning before the temperatures got too hot. And so what I discovered is that if I got a bike ride in, I felt way more awake the entire day. And it's this amazing phenomenon to me. I mean, I can wake up and feel so fatigued, and I do almost every day. I wake up just tired and thinking I just want to go back to bed. I go on a bike ride, I get my heart rate up, I get the endorphins going. I come home, I'm good to go for the rest of the day. I can go the entire day and feel way more awake simply just by exercising.
So why isn't that the solution for you then?
It's my primary solution, but I can't
Okay.
exercise 7
You
days a
can't
week.
you can't do it every day. Okay.
Yes,
Right.
enter the medication, which is what
Okay.
I love so much about this treatment plan is because, it's just not I mean, you shouldn't be exercising 7 days a week, right? Your body needs rest. And I'm sure there will probably be a lot of weeks that I might not take it at all. But
Mhm.
there's a few Sundays a month where I have to drive to church by myself, and that's our longest drive is to church. And that's like my hardest time. That's when it's hard for me to stay awake. Those are the days where it's like I need medication.
So
And
on the days where you can't exercise,
mhm,
then you would probably take the medication.
yeah.
Is that okay?
Mhm. Yeah, which is what I love about this solution is because it is a stimulant
Mhm.
and so, it is a controlled substance, but I'm not dependent on I don't have to take it. And so, I exercise most weeks I exercise 5 days a week. So
Mhm.
5 days a week I'm good. And then on maybe on a Saturday if, I don't have anything going on, then maybe I'm good, right? Maybe I don't need to take it, but maybe Friday I have a rest day, but it's my rest day and I've got a lot of schoolwork to do. And, I've got a lot of reading to do. And so I need to be able to stay awake and I wake up tired. That's the day I could take the medication.
So have you started
Hmm.
on the medication, and does it work for you? Like,
Yes.
if you take it in the morning, does it relieve the tiredness?
Yes, or at least it helps me stay awake. It doesn't completely wash away the fatigue, but I can stay awake. I can sit down, I can read for hours on end and not fall asleep and not be constantly fighting sleep. So it is helpful, but there are side effects. I do tend to sometimes I'll get a little bit of a headache. And
Mhm.
the most annoying thing is it makes me really hungry. It's what I
Uh-huh.
found
Yeah.
is because it's a stimulant and apparently it stimulates my appetite. And so it
Mhm.
just like, I'm like, man, I so hungry. And, that's probably my least favorite side effect of
Yeah.
it.
Mhm.
But, overall, I am very, very pleased with my treatment plan in that, I have this because it's just perfect. Because I have this medication that I can take on days where exercise just isn't feasible. But most days I don't have to. In fact, last week I was traveling and I spent the whole week in Washington. I didn't take my medication a single day because, I didn't need it. I mean, for one, that's one time where I am grateful for the idiopathic hypersomnia because you want to sleep on a plane. So I
Uh-huh.
did sleep
Yeah.
on a plane. When you have a 4-hour flight, a nap is great.
Yeah. So, see, here's the lesson for our listeners,
Mhm.
is that I think a lot of people resist going to, say, a sleep clinic or
Yeah,
even their doctor to talk about it because it can be, annoying or,
yeah,
hard to do the sleep study.
yeah.
But in the end, it's really can be positive.
Mhm.
And so I think your story is a good one for our listeners to remember that you did the hard things of the sleep study and you spent all day in that place, which sounded pretty awful. But in the end, you get a treatment plan that works for you.
Yeah.
And so my suggestion is sleep is so fundamental. It's so important.
Yes, yes.
And if you're struggling in the same way you were, it's really important to get it checked out
Mhm.
to figure it
Yes. Yeah,
out.
absolutely. So the 2 things that are fundamental for my sleep is my sleep hygiene and exercise.
Yeah. Yeah.
So and those are gonna be fundamental for any sort of sleep disorder. Now, I have a friend who I bike with who was diagnosed with narcolepsy, and she went through different treatment plans, and she's not currently doing any treatment plan because she was able to alter her lifestyle. So she has a job where she's active and she's moving all day, and so she doesn't have the problem of fighting sleep. So, if you can find a way and if you can cope, like maybe if you have a job in construction or if you have a job as a doctor, right, where you're moving and you're doing things all day, then okay, that's great. You have a great coping mechanism. But I'm a student, I'm in school, I'm
Right.
spending hours on end reading and I couldn't cope.
See, and that's the other reason. That's something that, say, a neuropsychologist or someone who is trained in, working with people with sleep issues can help you figure out, are there lifestyle changes that
Yes.
you can make? And sometimes, that can be enough. I said at the start of our episode that I'll ask about sleep, and I'll always
Hmm.
ask about sleep hygiene, because that's one of
Yeah.
those easy things to check. Is the bed comfortable? Or is the mattress comfortable? Is it dark enough? Is it cool
Hmm.
enough? Is it quiet enough? Or do you have white noise going on? Here's the thing. This is a bit of an aside. I'll just say this once and leave it. Dogs in the bed. I, oh my gosh. Do you know how many people I see who have dogs in their bed and they don't sleep well?
Or
And
cats.
or cats, but I'm thinking, okay, this is an easy fix. They won't get rid of the pet from the bed.
Yeah.
It's mind-boggling to me. Anyway,
Yeah.
my suggestion to our listeners, I love my dog. I really love my dog. I would never, ever sleep with my dog because I have hard enough time. Keep your
Boundaries.
boundaries. Keep your dog out of the bed. I think you'll be happier. Anyway, that's my that's my pet. So
Oh, there's Mark's soapbox
yeah,
for
that's
the
my
week.
soapbox for tonight.
Yeah. But I mean, sleep hygiene is something that everybody should be thinking about. And
Yeah.
sleep hygiene, it can feel really restrictive. And I'll admit, I felt overwhelmed by it at first because it's like you have to go to bed at the exact same time. Well, you can give yourself a half hour or maybe even an hour leeway and still
Yeah.
be fine.
Right.
You know,
And then the light, the blue
yes.
light, whatever the light that comes from
Yeah.
devices. I just thought dogs in the bed are not sleep hygiene. Just
No. No, they're not.
anyway, there are all sorts of things that you can do to alter
Yeah.
your lifestyle that make it, a little bit easier. I think for people who, are not going to fall into some of these categories of
Hmm.
narcolepsy or idiopathic hypersomnia, I think that I've mentioned Andrew Huberman and his podcast, a guy named Matthew Walker, who is a sleep specialist at UC Berkeley. That's worth listening to
Yeah.
because he has a lot of good ideas.
Yeah. And so another important part of sleep hygiene is having a set routine. And
Hmm.
it doesn't have to be extensive. My bedtime routine is very simple, but it's just that routine is the act of getting your brain ready for sleep. It's your body's way of saying, okay, it's time for me to go to
Right.
bed. So, one of the things that my doctor did recommend with to help with the restless leg syndrome was massaging your legs at night before sleep. So, I've incorporated that. So, if you're struggling, that I would say is the first place to start. Another helpful thing could be is to start keeping a log.
Hmm.
That's always helpful for if you're going to go see a doctor or any sort of specialist, is to start keeping a log of and to help you recognize your own patterns of, okay, what time did I go to bed? What time am I going to bed each night? How did I sleep? How did I feel? Did I wake up? And just to give more information. So if you're going to look into fixing your tiredness or fixing feeling tired all the time, you can start now today with a sleep log, right?
Right, and I think that logs are important for a lot of things, and the
Yeah.
reason is that sometimes it's hard to see patterns,
Yeah.
but if you're writing it down, then, you may not see the pattern. Often if you take it to someone like a physician or
Mhm.
psychologist, then it's easier to see what's going on in the pattern, and so I agree, it's a good step.
Yeah. Yeah.
And, they're always making, strides in either the medication or the testing or the CPAPs.
Mhm.
I mean, it's always changing.
Yeah.
And so it's not like it was 20 years ago. So it's worth getting help. I agree. That's
Yeah,
the
I mean,
takeaway.
and you may be like me, and so because for so long I just found reasons to justify, well, I'm tired because of this, or I'm tired because of this. For a long time I said, I'm a woman, so I just need more sleep. Is what is which and that is scientifically true. Like that
Okay. Yeah.
there is some truth that women do typically tend to need more sleep than men, but the amount of sleep and the way I was sleeping was not reasonable. In fact, here's my most extreme example. I did a big tour. It was a 100-mile bike ride over 2 days. I came home from that bike ride, or from that 2-day bike ride. I slept for 10 hours that night, came home from church, took a 4-hour nap, and I still went to bed that night and slept for 7 hours.
Right. But you've done this extreme physical thing. I mean,
Sure.
in some ways, it kind of makes sense
Yes.
that your body is recuperating.
Yes, and I am most fatigued days after a tour. So after a 50-mile bike ride, those are my hardest days. Those are the days that I am the most tired, and I plan for that. But, I shouldn't be tired because it's Wednesday and I slept for 7.5 hours instead of 8.5 hours last night, right? That
You're right.
is
You're right.
is not
You're right.
normal. So, anyways, next week we are going to get into the emotional effects of the pandemic. And I think I've in part resisted this one for a while because, well, the pandemic was hard and nobody likes talking about it. I think there's some resistance to the pandemic.
Well, I think that you and I talked about this earlier. There can be some political undertones to this, but we're
Yes.
going to stay away from that. I think you
Yes.
can talk about this entirely staying away from
Yeah.
politics because it affects a lot of people negatively. Still does.
Yeah. And there are still things that are going on. And so it's
Yeah.
an important thing to talk about.
Yeah.
So we will see you all next week.
Have a good week, everyone.
Have a question for Dr. Burton? How about a topic you'd like us to cover? Send us an email at mentalhealthpod21@gmail.com. This podcast was produced and edited by Liz Lang. Music is by Audio Lounge.